officials expect COVID-19 vaccine distribution to pick up speed after a slow start. Here in North Carolina, people 75 and older can start getting vaccinated this month.
But how soon you actually get your shot will vary depending on where you live. CBS 17's Michael Hyland's getting answers about the rollout in North Carolina.
Some communities will start giving shots to people over 75 this week, but in others, they're uncertain when that will happen. They say they still don't have enough shots to get through everyone in the current phase. The COVID-19 vaccine rollout will shift to the next phase, 1B, later this week in North Carolina. That'll start with people 75 and older, but the timeline varies across the state depending on supply. Gaston County outside Charlotte will start giving the shots Friday, but Ryan Jury with Wake County Public Health says here it's uncertain.
Yeah, I know everyone wants an answer, and I think, maybe we'll undercommit and overdeliver, I think, here in the county. But I think the real reality is the total number of doses that have come into the county, don't really cover the 1A criteria.
The CDC says about 330,000 doses have been distributed to North Carolina, with 94,000, or 29% of those actually used. For the nation as a whole, about a third of doses distributed have been administered. Democratic Congresswoman Kathy Manning, who was sworn in Sunday, criticized the process so far.
The current administration has not done a good job rolling out the vaccines, getting them delivered to where they need to be, and helping the states get those vaccines in the arms of the people who need them.
We need to improve.
Dr. Monsef Slaoui, chief advisor of Operation Warp Speed, said the pace already is picking up, with about 500,000 doses administered each of the last 3 days.
20 million doses of vaccines that as we had promised would be made available to the American people to be immunized with have been made available. 17.5 million have been shipped.
I think the real reality here is just it's like building the plane while flying it.
Jury says vaccinators in Wake County have the ability to expand quickly when enough doses are here, but he doesn't know when that will happen. Wake County officials say they have to get through everyone in the current phase 1A before moving to the next one. That includes workers in hospitals treating patients with COVID-19 and people in long-term care facilities. They don't know how much longer that's going to take. As of late last week, they still did not have enough doses to get through everybody in 1A. In Raleigh, Michael Hyland, CBS 17 News.
All right, thank you, Michael.